I want to talk with you a little bit about bipolar disorder. Bipolar disorder used to be referred to simply as manic depressive disorder. And this is typically identified as a moodiness ranging with extreme highs, called mania, to extreme lows, called depression. Many people, before getting professional assistance for the symptoms of bipolar, try self-medicating by falling into the use of street drugs or alcohol, and then they end up developing an addiction. It used to be thought that this was the only way to cope with the symptoms of bipolar. Now we know there is a proper way to diagnose these symptoms and to treat them. We now know a lot about the chemicals in the brain called neurotransmitters. Although there is still much to learn about the brain, we do now know something about those identified 144 neurotransmitters and what their function is. We have a better idea how these need to be balanced and how to balance them when they are not naturally balanced. It is not a good idea for a person to try to do this alone. An undiagnosed, untreated bipolar person can feel miserable and cause those around him to feel miserable too. Untreated, a person with bipolar can experience drug or alcohol addictions, negative or broken relationships. Bipolar affects men and women, and now we even know children. It can be difficult to detect in children as they tend to be rapid cyclers. That means back and forth between the highs and the lows quickly. The child becomes confused and scared. Bipolar can be treated with appropriate pharmaceuticals and appropriate counseling.